Good evening, Latha ma'am. The room is full now.
I would request the other panelists, other than the organizer and the panelists, to keep their mic mute.
Pratigya ma'am.
Yes, sir.
Yeah, ma'am. Latha's ma'am, videos and audio both are muted. Please.
Sir, I have enabled Latha ma'am's video.
Also audio both, please.
Yes, sir. Yes, sir. Audio is also enabled.
Latha ma'am, please check it once again.
From my end, sir, it is enabled.
Excuse me, there is some technical issue from ma'am's side, so she's just log out and will join within a second.
Okay, okay, sir.
Yeah, madam has joined. Good evening, ma'am. Welcome to the session. Madam Pratigya, can you help ma'am? I think there is issue with madam.
Sir, from my end, I have enabled everything.
Yeah, I can see
There
that.
must be some laptop issue then, I think. She is also the co-host, so no issue on that.
Audio is on, but not video.
We are unable to hear audio.
Ma'am's audio is also on. It is showing on here. Might be, ma'am, if you can check the laptop is not on mute.
Ma'am, why don't you try getting the lab and join?
Yeah, now it,
Now we
now
can
it,
see.
yes, yes, yes. When we can see you, but not able to listen you.
No, no audio, madam. Ma'am, please check whether your laptop is connected to Bluetooth or something like that. Please check the mic status.
Good evening, all delegate participants. There is some issue from the expert side, so we are waiting that the expert, as soon as she joins, we will start the session. Please bear with us. Ma'am has joined. Please make her co-host. Now, mic and video both we can see. Ma'am, please. We can see you now.
Yeah, now echo is there. I'm talking from mobile.
Ma'am, I think two devices are, you joined with two devices.
Echo.
So, ma'am, what you can do is you can mute one device. If like the mic of your phone is working mobile, then keep it on and keep the laptop speaker on mute.
Hello. Again echo வருதுங்க.
Ma'am, you logged in new device.
Yes,
So,
yes, yes.
mute your device.
Ma'am, you can mute yourself from laptop.
No, ma'am. Actually, your laptop mic is not working. You can bring laptop audio. You can mute 0 speaker. Laptop speaker make it 0. Then you can talk through mobile. Your laptop mic is not working, I think. So keep the volume of laptop speaker 0. Then you can start. So you will hear any echo.
Ma'am has disconnected, I think.
வரும்போது தர வெயிட் பண்ணு. பாரு, இதெல்லாம் ஏன் பாரு இப்படி எடுத்து போட்டு வச்சிருக்க? செருப்பெல்லாம் எனக்கு அங்க எடுத்து போட்டு வச்சிருக்கோம்.
Hello. Am I audible?
Yes, ma'am, you are audible, very much audible.
Okay. Allow the host to allow the video, no? Host to allow the video.
Host,
Yes, sir, it is done.
please allow the video for.
Sir, it is done.
No, it is not coming. See, I have logged in from 2 devices, so you have to allow 2 devices.
And what is the name of other device? The same name?
Or Purna, it will come as Purna, no?
Ma'am
POOR.
allowed both the devices. Both are in the same name.
Yes, yes. So now my audio is from mobile and video is from laptop. Okay, fine.
Yeah, over to you, Dr. Rupinder.
Okay,
I'm
sir,
extremely
thank
sorry,
you.
participants, for the inconvenience caused.
Good evening, everybody. First of all, I would like to welcome all of you and Dr. Latha Venkatesan, ma'am, President, CNRS North Zone, Dr. Muthu Venkatachalam, Organizing Secretary for the short-term course, Dr. Kamlesh Kumari Sharma, Vice President, CNRS North Zone, Mrs. Ilya, Secretary, Dr. Samriti Arora, Joint Secretary, Dr. Latha, Dr. Shiva Shankari, Dr. Marilyn, the support team of CBS and other delegates, researchers, faculty members, students, and my dear friends. I welcome all of you for the second day and the second session of this online short-term course in research methodology organized by Clinical Nursing Research Society, North Zone chapter. Yesterday, we had a discussion on the research process and overview by Dr. Deepika Khakha, Nursing Advisor to Government of India. And today the second session will be taken by Dr. Latha Venkatesan, Madam Professor and Principal, College of Nursing, AIIMS, Delhi. Madam will be discussing on research gaps in problem identification, variables, and statement. Before starting the session, I would like to introduce the speaker with you. Madam is Professor cum Principal, College of Nursing, AIIMS, New Delhi. And Madam has more than 32 years of total experience in the field of education, clinical nursing research, and is also the president of CNRS North Zone. She is a founder member of ANEI, and she is also PhD guide in WHO, INC, Rajiv Gandhi University of Health Sciences Consortium. She is the nursing thematic lead for learning content creation for COVID by Ministry of Health and Family Welfare. She has published several articles in index journals, authored textbooks. She is editor of many journals. She has organized several international, national conferences as well as short-term courses. Madam is currently involved in WHO Southeast Asia region project of AIIMS UCLA at UK project. She is advisory board member of Skill to Scale Indo-Sweden Collaboration Initiative. Madam is committee member of ICMR Bhopal. She is UPSC advisor, selection committee member, and member of UG and PG students admission committee of various AIIMS, expert committee member of RIMS and NIGRIMS. She is experienced as governing council member, president of faculty, member of selection committee, finance committee, senate member, board of studies member, board of research member, doctoral advisory committee member of many distinguished universities, and the list of Madam's achievements and Madam's introduction is long. So, but I would like to stop here and welcome Ma'am for taking her session on research gaps and problem identification, variables, and statement. And I request all the participants to type their questions in the chat box, which will be answered towards the end of the session. And for the candidates who could not connect to the Zoom session, can join through live YouTube link, which will be shared in the chat box. Thank you. Over to ma'am.
Is my screen visible?
Yes,
Hello.
ma'am. Yes,
Yes,
ma'am.
ma'am.
Yeah. Thank you, Rupinder, for the kind introduction. Is it echoing?
No, ma'am.
Okay. Thank
But
you.
ma'am can't see your video.
You can see the presentation,
Yes, ma'am.
but you're not able to see my face.
Yes.
Ma'am, your
Ma'am, we are
face is
able to
also
see.
visible.
You are also
Both
visible.
video and slide are visible, ma'am.
Okay, fine. So shall we start with the session?
Yes, ma'am, we can start.
Okay. So once again, we welcome all the participants on behalf of CNRS North Zone. And today's session is on research problem, how to identify it, how to evaluate the problem, and write an appropriate research statement. So in the entire research process, the most difficult part is identification of the problem. And this is the first step of the research process. It is similar to identify the destination before starting a journey. And once you identify the problem, it serves as the foundation for whole research process. So what is this research problem? A research problem is a definite or clear expression about an area of concern, a condition to be improved upon, a difficulty to be eliminated, or a troubling question that exists in scholarly literature, in theory, or within existing practice that points to a need for understanding and deliberate investigation. So if many students are attending, they may be wanting to have a definition of research. So the definition of research problem goes like this. A research problem can be defined as a statement regarding the area of concern, a condition that needs to be improved, an unresolved question that exists in the literature, a difficulty that needs to be eliminated, or any point that needs some meaningful investigation. And sometimes we use the word research problem statement. Sometimes we use research questions. So what is the difference? Research questions are nothing but they are specific queries the researchers want to answer in addressing the research problem. Only thing is the difference between research statement and research question is it is stated in an interrogative manner. We will be having examples to discuss about how to state a research problem or research question. So now research problem versus research question, the key difference is the research problem refers to an issue or a difficulty or gap in the knowledge that is being addressed in research. Whereas a research question, if you see, it is a statement that is in the form of a question aiming to study, learn, examine, and explore more about the research topic. So this is the difference between a research problem and a research question. Here I have stated two examples to understand the difference between research problem and research question. If you look at the problem, blind cannot communicate with majority of the society. This is the research problem. How you can convert it into a question? How should a computer vision device be developed to address the needs of the blind? Then it becomes the research question. Similarly, there is another area of concern which is being taken as an example, that is technology and health. That is, epilepsy cannot be understood experimentally. This is the research problem area. And the question is, can a mathematical model be created to understand and experiment with epileptic brain activity? So this is how the research problem is the broad area and research question narrows it down. So that is the difference between a research problem and a research question. And the most difficult part is where to find the research problem. Can I have some answers in the chat box? Where can we get the research problem? Because this course is designed for the postgraduate students. The moment you are asked to identify the research problem, the students, I have seen the students becoming very stressful. So they ask for problems to various people. So can you type in the chat box, where do you find the research problem? Yeah, somebody has written from the personal experiences. Yes, yes. You can find the problem from your own clinical experience. Yes, from nursing practice, from the clinical settings. Very good. Yes. Where else we can find the research problem? Yes, workplace, clinical settings, where lack of something is there. That is when you identify a gap. Yes. Critical appraisal of the literature. Excellent. From previous research. Yes. From review of literature. Yes. So these are all some of the sources of identifying the research problem. So, as many of you have mentioned, the primary source of identifying a research problem is from our own experience or from the clinical fieldwork. Of course, the nursing literature also is a good source of problem. Sometimes the pressing social issues can become a research problem, and the theories can become the theories can be a source of problem. So let us see in detail how these areas act as the sources for identifying the research problem. If you look at the experience and the clinical field Hello, the slides are visible. Hello.
Yes, ma'am, visible, but the slideshow is not. Slideshow is not. The slides are visible.
Yes. I don't know, today a lot of technical issues. Is it moving now?
Yes, ma'am.
Yeah. So the sources of research problem are mainly from our own experience or clinical field work. It may be from the hospital, or it may be from the school or community, or from our own teaching experiences, and sometimes from the class discussions. So usually the clinical experience will be really helpful to identify a suitable research problem. And when we do not have clinical experience, what to do? Because nowadays students are directly doing MSc nursing, or with less experience, they are doing MSc nursing. So they may not have that kind of an exposure to identify a researchable problem from the clinical area. Then what to do? Then they can get ideas from the external sources. So they can consult with the course instructors, they can discuss with their advisors, professors, faculty members. Usually the clinical faculty are able to give better researchable ideas, because some of the difficulties which they are coming across, they would like to have a solution and they suggest. So you can discuss with the clinicians to give ideas. And social issues also can become a major source of problem. For example, COVID came. So when COVID came, it was an emerging issue. So immediately a lot of research was done related to COVID. So social issues can be a good source of problem. Now, age of the aging population is increasing, and the family size is decreasing. So a lot of research related to geriatric population is required now. So they are identifying methods to help the geriatric population. So this is a social innovation. Lot of social innovation ideas are coming out. Sometimes you can also take global issues. Global issues are the issues which affects the population in general. So we can take the global issues. Now the climate change, global warming, this is a global issue. It can be taken how we can reduce the global warming. One example which I was telling was, you can assess the plastic waste inside the hospital. We tell people that reduce the plastic waste. Immediately we think of reducing plastic waste when we are going for shopping. But what about inside the hospital? When I was a student and beginning years of experience, we were using only glass syringes and glass IV bottles. Now you see everywhere plastics. So inside the hospitals, a lot of plastic waste is getting created every day. And that is also a contributing factor for the global warming. So these kind of issues also can be selected for research. Then theories, many a times theories are a source of identifying the research problem. Only in nursing you will find conceptual frameworks are used in research. Whereas in other disciplines, conceptual frameworks are not used. So in that way, nursing is definitely enriched with a lot of theories. You can read the theories and you can apply the theories and you can test the theories. And sometimes you can do the research even to construct the theory. I can tell an example for this Oram self-care deficit theory. Oram self-care deficit theory defines the self-care required by patients. And it is classified into 3 levels. That is, they are completely dependent on the healthcare system, and partially dependent and supportive educative system. This is the 3 levels you will find patients getting admitted in the hospital. And this is also a model of progressive patient care. I would say that a patient may be admitted as a fully dependent patient, but over a period of time, he recovers and moves into the partly dependent system and into supportive educative system. So when you want to do it as a research study, how can you do it as a research study? You can see how many days a patient takes to move from fully dependent system to a supportive educative system. Then what is the amount of nursing care required? How many nurses are required? It can be used for manpower planning. It can be used for facilitating the reduction of length of stay in the hospital. What activities can be done to make the patient to move quickly into supportive educative system? And when they come into supportive educative system, what kind of support and education they require? So like this, the theory, one single theory can become a source of multiple research problems. One of my students has done safe discharge program for the mothers of preterm newborns, post-surgical preterm newborns. So she prepared the mothers for caring the newborn after discharge at home. So this is a supportive educative system, which is part of the Warham self-care deficit theory. So you can see that how a hospital is having the supportive educative system. How are we equipping the patients and the families before getting discharged from the hospital to care for their patients at home? So this is one source of research problem. And usually when it comes to research problem, immediately we will Google. It is not only for research problem, any of the informational needs now Google is of a great support. So people immediately Google. When they Google, what do they see? They can see the previous conferences. Today I was seeing whether I can pick up the research topics which was published in previous international International Council of Nursing conferences, or I attended one conference in Singapore. So very interesting topics were presented there. So I thought whether it is there available in the web for me to copy and discuss it here. No, so like this, you can see the workshops, paper presentations, and you can also use the textbooks, journal articles, and we have databases. Databases like Senegal is the database for nursing. So in Senegal, the articles published in index journals are included, and they give usually the abstract and the recommendation for further studies. So when you review the literature, you have to see the recommendation given by the researcher for expanding the study or for future study. So that is also a good source of selecting the research problem. And once you have selected the research problem, we have to develop the research problem. That means the research problem has to be written down in a feasible manner, how you can conduct the study. So that involves 4 steps. First of all, you have to select the topic. The selection of the topic can be a broader area. For example, you want to do your research breastfeeding as the broader area. But in breastfeeding, there are so many topics are there, so many areas are there which are already researched, already published. So what are you going to study in the area of breastfeeding? Then you have to further narrow down the topic. Are you going to study preparation of the mothers antenatally for breastfeeding, or are you going to study what is the percentage of initiation of breastfeeding in a given setting? Or are you going to see how many mothers are able to breastfeed exclusively? And still you can narrow down whether working mothers are able to do exclusive breastfeeding, or the homemakers are able to do the breastfeeding. Are they able to utilize the governmental facilities or the leave facilities which are being recommended by the government? So like that, you can further narrow it down. Then you need to evaluate the problem and you need to communicate the research problem. So we will see these steps in detail, how to select a problem, how to narrow it down, how to evaluate it, and how to communicate it. So the first step is selecting the topic. So the first and foremost requirement is you need to have an inquisitive and imaginative mind. you have to think why it is in this order. If we change the order, what will happen? And you have to have an imaginative mind. Then you will be able to come up with the researchable problem. For example, you see the cots, the hospital cots. Earlier days, we had the cot where you have to use the backrest for keeping the patient in Fowler's position. I think nowadays backrests are not found in the hospital because every bed you have electronic beds, and manually also you can raise the head and foot end, and you can use the bed in multiple ways. So how this has come, how this product development has happened, because it is an inquisitive mind and an imaginative mind, which is bringing in lot of products into the hospital industry. And we also need to have a questioning attitude. We have to wonder why. I think this questioning attitude came during COVID also. All of us were taking only physical classes. But today we are online, connected across the country. We have international participants are also attending the sessions. How is it happening? Because there is when there was a limitation to carry upon the existing method, then we thought, but still we have to continue education. You cannot stop learning. You cannot stop the education. You cannot stop caring for the patients. Then how to do in a different way? Then immediately all have switched on to the online mode of education. So we have to think differently. Now, here also you have to have a mind that when some new products are introduced, immediately you should not agree upon, because you have to have the questioning mind, how it is different, how it is going to change your existing practice. Is it an addition or you're going to totally change the practice? For example, this VAP bundle has come. In VAP bundle, 4 parameters are emphasized. That is elevating the head end of the patient and frequent oral sectioning, peptic ulcer prophylaxis and DVT prophylaxis. Is that only the ventilator care? Is that only the care of the patients on ventilator? What about the alarm management? What about the infection control? And what about hydration of the patient? What about sedation, holidays, weaning? There are so many aspects which we were doing earlier that has to be continued, and these 4 aspects were additionally added. So you have to have a questioning attitude when where you're asked to change the practice. You need to have a questioning attitude in your mind. So then you will be able to identify the researchable problem. You will compare the old method with the newer method. You will find out the advantages and disadvantages. That is how the evidence-based practice also is been selected, because you have multiple solutions for a single problem. Then the second requirement is you have to brainstorm to identify a research problem within the area of interest. Whenever there is a problem, you have to brainstorm among your team, and you have to discuss with people who are having similar kind of interest or experience. Then they will come up with so many ideas. Then you can jot down the ideas. For example, now one student is doing sleep pattern of unconscious patients. Then the ideas have to be brainstormed, how you can study the sleep pattern of unconscious patients. Because patients are unconscious, we think that the patient is sleeping, but they are not actually sleeping. So we have to measure whether they are sleeping or not. Then how will you measure it? Then brainstorming, so many ideas came, and we are having smartwatches. And one of the clinicians said that we can use smartwatches. It uses wrist actigraphy to detect the stages of sleep even among unconscious patients. So when this was told, initially a lot of skepticism came. People were doubtful how a smartwatch will detect, is it accurate, what methodology it is using. So many critics will come. But in the initial stages, you have to jot down all the problems. In the initial stage itself, don't discard any idea or do not negatively appraise an idea. First, you jot down all the possible solutions, all the possible methods of solving a problem. Then you can find out whether it is researchable or not. Then the second stage is you have to narrow down the topic. So how will you narrow down the topic? After identifying a topic of interest, you have to see that what are all the areas you can study. For example, I can say that what is the number of exposure to ultrasound in the antenatal period, and whether the child is developing any dyslexia because of the antenatal exposure. Of course, ultrasound is very safe. People say that it is very safe and it doesn't have any side effects. But to prove that, some people wanted to know that whether it is affecting the language development of the child. Then you have to, how will you identify that? Then the child, you have to do a research for 3 years. Is it really possible? Then what you can do, you can further narrow down. You can go directly to your preschool and see and retrospectively do it. So the methodology, all those you can narrow down. You take this breastfeeding example. Breastfeeding is the broader area we have taken. Then now, what is your area of interest in breastfeeding? Is it the initiation of breastfeeding, or you want to see the breastfeeding problems, or you want to study only the exclusive breastfeeding, or you want to study the facilities in an organization? Is it a baby-friendly hospital initiative? How the hospital is supporting breastfeeding? So you have to further narrow down the area of research. Then the third step is the most important step. If we are not carefully practicing this step, then you will land up with problems when you are in between the project. So you have to evaluate the topic appropriately and ideally at the beginning of the selection of the topic itself. So how will you evaluate the topic? You, first of all, you have to see the significance of the problem. Is the problem topic or significant enough? For example, when I quote the example as breastfeeding, you may be thinking, oh, breastfeeding in India, all the mothers culturally, they are encouraged. What is the breastfeeding is such a simple one, and why? What is there to research? This might have been the thought process which would have came into your mind when I mentioned breastfeeding. But if you look at the National Family Health Survey, when it was published in the year 2016, only 40% of the newborns were given initiation of breastfeeding within 1 hour of birth. And recently in 2022, the fifth report was published. It is only 40.4%. That means only there is no significant increase in the initiation of breastfeeding. So why the initiation of breastfeeding within 1 hour of birth is not happening? So this is how you have to see the significance of the problem can be always substituted with statistical references. Then you have to look at the researchability of the problem. Researchability of the problem is, the question is very clear and researchable. This one, for example, I can say kangaroo mother care. When 20 years before, I think it's more than 20 years before, I wanted to implement the kangaroo mother care. So when I wanted to do that time this concept was not very popular in India. And it was not, the method of implementing kangaroo mother care was not clearly available. How long you have to do, and how, to which newborn you can do, and where will you do. These kind of literature was not available 25 years before. Of course, those days we did not have internet and Google also to search and get the ideas. So you have to see the researchability of the problem. Is the question is clear and researchable? Then the third next step is evaluating the feasibility of the problem. You can see the economic feasibility, technical feasibility, operational feasibility, scheduling feasibility and all. So this feasibility is how far it is practical and possible for you to do it. And it is free of unknown hazards and dangers. Yesterday, somebody was asking that they are using a lot of products, the nutrition-based products like curry leaves for diabetes control and moringa leaves for improving the hemoglobin level. Like that, we are using multiple methods. Then you have to see that it is free of unknown hazards or dangers. And is it stated clearly or is it ambiguous? This analysis also has to take place. And when you are seeing the feasibility is divided into multiple other subheadings. You have to see the technical feasibility and in terms of the equipment also, whether you require assistance. Now, when you are doing student research, you will be personally involved in data collection. But when you do a longitudinal study over many years, and when you do a multicentric study, or when you do a study on a huge population, then how many assistants you require, who will collect the data, and what equipment you require, what apparatus you require. And you also have to see whether the persons are having the technical skills to handle the apparatus, and is the equipment is standardized and working properly, and whether transportation is needed for the equipment to be transmitted to the area of data collection. I can give one example here. One study was conducted to do the screening for cervical cancer in the home setting using Lugol's iodine technique. So the student did not have the necessary knowledge and skills how to do the Lugol's iodine technique for detecting cervical cancer. Then we have sent her to the expert, and a pathologist has trained her how to use Lugol's iodine for detecting cervical cancer. At home also this can be done. Then the student was equipped. Then the next problem came. Then when she was doing community health nursing, so in community she has to do at home setting. In home setting, where she will do it? She has to go from house to house. For Lugol's iodine, we require a lamp, a circular lamp, which is called as Magna Vision. This Magna Vision was mounted on a stand. She has to carry that. Then how she will carry it? Then you have to identify a location to keep this Magna Vision equipment, light source equipment, in the community itself. So we spoke to the community leader, and it was kept in the community hall. Like that, there are these are all the problems which we came across when you want to use a technology or a technique at home level. Similarly, in the hospital also this may take place. When I wanted to implement kangaroo mother care, when you implement kangaroo mother care, when the newborn is put on the mother's breast, it feels very comfortable. And when it is comfortable, what happens? It sleeps adequately. When it sleeps adequately, the perfusion to the brain will increase. So the sucking reflex will come back quickly. So the breastfeeding can be started. So this is the concept behind kangaroo mother care. So you have to see the oxygen saturation and temperature of the newborn. Those days, to see the oxygen saturation, now we have finger pulse oximeter. You can check the oxygen saturation anywhere. But those days, the oxygen pulse oximeter was available. Entire hospital will have only 2 pulse oximeters, one in theater, one in ICU. So who will give the pulse oximeter? I spoke to the company, can they spare? And they said, no, we cannot give the, we will give the demo pace, but after your research, you have to purchase the equipment. No, those days, pulse oximeter was costing around 1,50,000 rupees, and our salaries were very less. So it was not affordable. So I have to drop the study because of lack of the technical equipment. So you have to do this kind of a feasibility analysis. I can give multiple examples. Sometime you may be wanting, one student did, she wanted to see the total serum protein level and how it is affecting the fetal weight, maternal serum protein and the fetal weight. So she has to assess the maternal serum protein. Maternal serum protein is not a routine investigation which is done for the antenatal mothers. Then she has to spare money to see this total serum protein. So you should have the money also, not only the equipment, money also. So these are all the feasibility studies you have to do. Next is the economic feasibility. In the economic feasibility, you must see what are all the expenses. The expenses may be for the literature search, internet access charges, personnel cost, study participants cost. And you also, because sometimes the incentives will be asked. Well, we did once, we were developing a video on breastfeeding. So we brought some postnatal mothers from the community area with the consent, and they came. Initially they came. Then when they saw all the cameras were set and we were taking video, they were going on increasing the cost. They have to say that you have to pay us this much, that much. Sometimes you have to pay to the participants. And when it is a funded research, the participants are given travel cost, the food, conveyance cost are all given. So those all have to be included in the project, the study participants cost. Then the supplies, what are all the supplies you require, including the stationaries and printing and duplication costs, and equipment cost, computer related expenses, laboratory fees. If you have biophysiological parameters, then you have to have laboratory fees. One student did evaluating the effectiveness of soap and water hand washing procedure and using alcohol based hand hygiene solution. Then she has to take the swab after nurses are washing hands with soap and water and after using alcohol based hand hygiene solution. Then who will pay for it? So you have to see the laboratory fees, because you take the sample swab and send for microbial culture. Then who will bear the cost of the um, laboratory tests and transportation costs? If the people are nearby, it is okay. But if the people are spread out, one study we have done where fenugreek was given to the diabetic patients, and the student has to distribute the fenugreek early morning for the diabetic patients who are living in 5 kilometer distance. Then what is the transportation cost? Daily you have to travel 5 kilometers from your area and come back. So you have to see the transportation cost. Or sometimes the patient has to come to your area and you may have to bear the transportation cost of the patients. So these all have to be calculated and you must see whether it is affordable. Then you have to see the operational feasibility. What is this operational feasibility? That is the time and timing. There is a difference between time and timing. Time is what time the time of the year or the month of the year. Timing is in a day when you are collecting the data. I can give a typical example. You want to do some study on COPD patients. COPD patients have the exacerbations during the winter months. But your data collection as a student, you are getting it in the month of May or June, where you will not see many asthmatic patients or COPD patients because it is summer. So how will you collect the data? So you have to see the time of the month. Even in obstetrics, some months are marriages do not happen. Some months are considered inauspicious and the marriages do not happen. And what happens? The childbirth also in certain months you will see it is very less. So you have to see the trend analysis, how the patients are getting admitted, which month the more number of patients are getting admitted, which month they are less. And timing is also very, very important. When are you going to collect the data? And the subjects must be available during that time. And what is the distance you have to travel? What is your experience? All these are part of the operational feasibility. Timing is also very important. I did the study transferring the newborn to the bedside after cesarean section and helping them to establish the breastfeeding instead of keeping them in the nursery. So it was a 24-hour cost-effective study. I have to collect the data every 4 hours. Then what happens if 4 babies are born? Then completely 24 hours you're occupied. So you have to see the timing also when you will be doing it. So like that, there are many factors which has to be considered under the operational feasibility. Transportation also, I said, if you are traveling to multiple houses in the community area, you must see the transportation facilities, time taken for transportation, how much distance you have to travel, or if it is a multi-centric study, who will be collecting the data, how they will be reaching out to the population, and the experience of the researcher. Experience of the researcher is also very, very important. Sometimes the students ask for some problems and we tell, okay, you select this area of study. And it may be of an interest to the guide, but it may not be interesting to the students. That problem happens. In my experience itself, sometime I was telling one student, you please take mixed method study. You can do a quantitative study and qualitative study. Because the student was a brilliant student, so I thought she will be able to do a mixed method study. But then later on, I came to know that the student was feeling that why only for me a different research design is given. I have to work extra and I am not having the experience of conducting a mixed method study, and there are no studies available for me to refer, which was done by the previous batches of students. So it was not interesting for them. So you have to see the experience of the researcher, whether they will be able to conduct the research, carry upon the research. That is also an important factor to be taken into consideration. Sometimes they would have worked in cardiothoracic area, but they would have got a different specialty. And now you have to really make them to do research in the area of specialty taken in masters. So totally they have to orient themselves to the newer specialty. So these are all some of the difficulties. The most important factor is it must be interesting to the researcher. The researcher should have genuine interest and curiosity to conduct the research. Then only the research will become successful. If somebody else is suggesting, or if the researcher is not having adequate experience or not interested in a particular study, then throughout the research project, she will be carrying it out with regrets. Not happily she will conduct the research. So we have to make sure that is it really interesting to the researcher. The researcher should have the genuine interest and curiosity to take up the research project. So these are all the feasibility analysis we have to do. Now you have selected the topic, you have narrowed down the topic, you have evaluated the topic for feasibility. Now you have to write down, and so you have to keep some in mind what are all the criteria for good research topics. As I said, it must be interesting, it must be researchable, and it must be significantly contributing to the improvement and understanding of the nursing education and practice. Sometimes they do a study. You see, the structured teaching program studies, you see, it is our duty to educate the patient and family members. And after the education, naturally, the knowledge will improve. But now we see a lot of pre-test post-test studies, and pre-test post-test studies are done, and the improvement in the knowledge is being documented. And then the findings sleeps in the library. What is the use? So we have to do a study which will be significantly contributing to the knowledge base of our profession. And it must be manageable and it must be ethical. We cannot, we have to follow the principles of natural justice, and unethical research activities cannot be carried out. It should not embarrass and harm the participant. And finally, we have to communicate the topic. So communication of the research problem is done through problem statement. So you have to write the problem statement. It has to be carefully stated before proceeding further. So when you're writing down the research problem statement, there are certain components which needs to be satisfied. If you see the research problem, many studies, they mention the research design, the purpose of the study, like to compare, to evaluate, like that. They mention the purpose of the study, and variables are included in the research problem statement, and they mention the population and setting. But out of all these components, the variables are the major and important component of a research problem statement. So let us see what are these variables and how to identify the variables and state the variables. So if you look at the variables, in quantitative studies, concepts or ideas are usually referred as a variable, and ultimately it becomes the data. The variables which are measured becomes the data. And in qualitative studies, the concepts are known as phenomena. So you study the concepts as variables in quantitative study, whereas in qualitative study, you will be studying the phenomena. So what is a variable? Variable is anything that can change or anything that is liable to vary. I have just given a picture here. You know, a person, same person, you see multiple emotions. The emotions keeps changing, you know. According to the patient's condition, the reaction of the family members also change. And so a variable is something which changes. You know, before pain medication, the patient's response will be different, but after the pain medication, the patient responds differently. So this is a variable response of the patient to the pain medication. That is a variable. So before and after medication, there are changes. And you can also see age also can be considered as a variable, because age can take different values, and different people are the same person at different times. You take a mother breastfeeding project, you will take the antenatal mother, you will prepare her, and she will be delivering in the labor room where she has to start the breastfeeding, and she becomes a postnatal woman, and she becomes the mother of a infant or mother of a toddler, and it differs. The same woman But she is a pregnant woman, then she is a laboring woman, she is a postnatal woman, she is a mother of an infant, toddler, mother of an adolescent, like that. The same person undergoes multiple stages in life. So this is a variable. So a variable is nothing but something which varies, in simple words. So what are the characteristics of the variables? Characteristics of the variables, if you see, um, it refers to the measurable characteristics. Measurable characteristics and the qualities, certain traits, attributes of a particular individual, objects or situation being studied in research are the characteristics of the variables. And the variables are the central building blocks of quantitative studies. Let it be a non-experimental study or an experimental study, we need to have variables. And weight, body temperature, stress, anxiety, and nutritional status are all example for the variables. And in quantitative research, all aspects of the human beings are called as variables. And the variables are classified. The variables are called as continuous, discrete, and categorical variables, active versus attribute variables, dependent versus independent variables, extraneous and uh, um, uh, confounding variables, abstract versus concrete variables. Like this, multiple grouping of variables are done. So let us see what are they. So what is this continuous variable? Continuous variable is when you are measuring, it has got continuous values. For example, you want to measure the weight of a person. You can mention in grams also. You can say that the person's weight is 52.5 kg. So you can present it on a continuum. Or you're seeing the height. You can say that they are 5 feet and 2 inches. Like that, no, the data falls on a continuum. That is called as a continuous variable. Age can be a continuous variable. Weight, height, hemoglobin, oxygen saturation, serum potassium values, and all these can be continuous variable. All the biochemical parameters also can be called as continuous variable, because even you can say in milliliter, you can say in milli equivalent, and you can say in millimeter. So it is measurable and the data can be presented on as a continuous data. Those are called as continuous variable. And discrete variable. What is discrete variable? Discrete variable means it has a finite number. You cannot divide into decimals. So these are known as discrete variables. For example, number of children. Number of children you can only mention in whole numbers, like one child, no child, or 2 or 3 children. You cannot say that they have 1.5 children, because it will be totally meaningless. And between the values of 1 and 3, only 2 is possible. So these are all the discrete variables where you cannot give the decimals. No, so these are called as discrete variables. And there are categorical variables. Categorical variable means they belong to a certain category. For example, gender. You can say whether they are male or female. Now transgenders also have come, but they fit into a particular category. Marital status, they may be single, they may be married, divorced. So they fall into some categories. Blood group, A, B, O, like that. No, you can categorize them into based on the blood group. And religion. So like this, they fall into certain category, which is known as categorical variable. And categorical variables will have distinct values. And already I have explained this. And what is this concrete versus abstract variables? Some variables are measurable. You can see with your own eyes. For example, weight. If a patient stands on the weighing machine, you can see the weight of the person, height of the person. You can measure the blood pressure. You can say the pulse rate. You can count the pulse rate and age of the person. So all these are concrete variables. Whereas there are certain variables, the psychological variables, especially like anxiety, depression, hope, fatigue, these are not visible to the eyes. Even pain is an abstract variable. Pain only if the person says you will know, or from the facial expression you will be making a guess, but sometimes it may not be actually describing what the patient is undergoing. Some patients may be experiencing pain, but their level of tolerance may be high. It may not be visible in their facial expression. So these are abstract variables which are not observable, or which are not measurable with biophysical equipments. They are known as abstract variables. The next category is active versus attribute variables. What is active versus attribute variables? Active variable is the variable which is created by the researcher, and it is known as active variable. For example, interventional variable. You want to do yoga for menopausal women, teach yoga for menopausal women, and you want to see how they are able to cope up with the menopausal symptoms. Then the yoga becomes an active variable. You may give some specific dietary intake, or you may do some psychological intervention to reduce their stress levels, coping mechanisms. All those becomes active variable where the researcher is actively involved, and it can also called as independent variable, or a manipulated variable, or an experimental variable also. Whereas these are some of the examples for active variable. For example, effectiveness of music therapy on reduction of stress, where music therapy is an active variable. Effectiveness of family counseling on reduction of family burden, then family counseling is the variable. What is this attribute variable? Attribute variables are the variables that describe the study sample characteristics. Usually these are the demographic characteristics. For example, age. These attribute variables you cannot change. You are not going to manipulate. These are already present in the individual. For example, ethnic background, their level of education, their age, gender, blood group. These are all already present in the individual. Then they are called as the attribute variables. Usually the demographic variables are the attribute variables. Why these attribute variables are important? You can see the association between the attribute variables and the response to your interventional variable, or response to the outcome of the study intervention. So the attribute variables can be compared based on the attribute variables if there is any difference. For example, age and stress. You can see age of the infertile women and stress in infertile women. Is there is any association between the age and the stress in infertile women? You can evaluate. And you can also see the age of the mother and outcome of the pregnancy. And you can see the economic status of the patients and how they are able to afford to purchase the drugs and comply for taking up the drugs. So like this, the attribute variables will be helpful to find out the association and relationship. And these are the important variables, that is independent versus dependent variables, and it is commonly used. Independent variable is the researcher has the independence to modify the variable. It is otherwise known as intervention variable or a cause variable, because you're going to do some intervention which acts as a cause. And dependent variable is the effect variable. That is how the intervention is going to influence the outcome of the study. So that is the effect variable. So independent and dependent variables are commonly used terminology. So let us see the examples. Independent variable is the variable that stands alone and is not dependent on any other variable. And this will be followed by the dependent variable. So as we saw, independent variable is the cause and dependent variable is the effect. It is also known as treatment variable, stimulus variable, action variable. Multiple words are being used. And dependent variable is usually the effect or the outcome of the study. For example, you see problem-based learning is the cause variable, and the academic achievement of the students is the effect variable. So when you use different methods of teaching, how the students' performance improves. So like this, you can have multiple other studies can be framed like this. We saw effect of music therapy upon the stress in infertile women. So that is music therapy is the cause, and the stress is the effect variable. And there are some variables which are known as extraneous variable or confounding variables. What is this extraneous variable or confounding variables? These are the variables other than independent variable that may affect the research outcomes, and they are termed as extraneous or confounding variables. That is, some of the variables which you have not found at the beginning of the study, which is not part of the study, that is known as extraneous or confounding variables. For example, I would say that iron and folic acid tablet given to the mothers, and you want to see how much the hemoglobin level is improving among the pregnant women. They may come to the hospital. Iron and folic acid is given free of cost in the maternity centers, and they will be advised, they will be educated the importance, they will be asked to take the iron and folic acid tablet. But what will happen? The lady goes to the goes home and takes this iron and folic acid tablet. Then she may have side effects of that, like gastric irritation or constipation. Or the mother-in-law or the sister-in-law may say that, oh, don't take iron tablet. Some myths may be there. The baby may become dark in color. So people will advise, don't take this. You take instead of tablets, you take iron-rich food. So many people will come and give alternate advices. So the women may undergo the confusion, and when she comes back for the next visit, you will ask, have you taken iron and folic acid? If she says, if she is not taken, then she will be scolded. So she will give a socially desirable answer, yes, I have taken the iron and folic acid tablet. So these are some of the confounding variables, extraneous variables, which may influence the intervention. So I was doing positive therapy for infertile women. When we did positive therapy for infertile women, the extraneous and confounding variables was they will be waiting for ultrasound. I will go and call them for positive therapy, which will take minimum of 1 hour per month. So meanwhile, they are not able to concentrate on positive therapy and relax, because in their mind, their queue in for going for ultrasound is there. So sometimes they say that, oh no, I'm stressed, I'm not able to relax because I'm missing the queue, I don't have time. So these are all some of the confounding variables we were coming across. And when we were implementing positive therapy, you require a complete noise-free environment. And in the hospital, finding a noise-free environment without any disturbance is very difficult. So that was one of the confounding variables. The noise was interfering with the relaxation. Then we moved it to the yoga room, a different setting was created. So all these are extraneous and confounding variables. This is where the importance of pilot study comes. You have to do pilot study. So when we do pilot study, this extraneous and confounding variables can be identified and they can be delimited at the beginning of the study. So this is how the diagrammatically it is represented. That is, extraneous or confounding variables. The program is there and the observation is there. And you will see a lot of alternative variables which are influencing. That is the confounding variable. Then homogeneous and heterogeneous groups are there. What is this homogeneous and heterogeneous groups or homogeneous and heterogeneous variables? When you're recruiting participants, the common variables which they share are called as homogeneous variables. For example, you are recruiting antenatal women for breastfeeding sessions, breastfeeding preparation. What is the homogeneous variable? All of them are pregnant and they come to a particular setting. That is homogeneous variable. Then what is the heterogeneous variable? Among the same population, there will be variation. You may have educated mother, you may have uneducated mother, you may have mothers who speak a particular language, and you may have primigravida and multigravida. Like that, among the pregnant women, you will have different people. Then that is called as heterogeneous variable. So usually they do a chi-square test to find out the population is homogeneous when you are recruiting. So this is homogeneous variables and heterogeneous variables. And once you identify the variables, you are supposed to define the variables. So this definition of the variables, there are two different definitions are there. That is, one is the theoretical definition and the operational definition. What is theoretical definition? It is nothing but dictionary definition, or which has been already available in the textbooks or defined by an author. This is a conceptual definition. What is operational definition? Operational definition is how it is being used in your research. how it is performed in your research. That is operational definition. For example, stress, you want to theoretically define. You will define what is the dictionary definition given for stress. That will become theoretical definition. Whereas in your study, you may be measuring the stress in infertile women. Then you will be using a scale for measuring the stress in infertile women. So then it becomes the operational definition. It is the stress of infertile women. You can also describe what type of infertile women or infertile couple. Then you are going to measure their stress before the treatment or after the treatment. So like that, it becomes the operational definition. So an operational definition describes or defines a variable in terms of the operations used to produce it in the study or techniques used to measure it. As I mentioned, stress measuring technique. Or you may be saying that you want to see the serum protein level and what is the weight gain in the fetus or the birth weight of the newborn. So you have to say that maternal serum protein as measured by on which month, how you are going to measure it, and the newborn weight. So you will be operationally defining when you will be measuring the weight of the newborn or weight of the fetus immediately after birth or after a few days or just before discharge. So like this, when you can define it, then it becomes the operational definition. And it must be precise enough that anyone reading or a review of your research could replicate your study. That is why it has been operationally defined. And this I have already explained. Now there is a learning activity which we have included. You have to identify the variables in the following research. See, you can also write down the operational definitions also. Effectiveness of post-operative counseling on reducing post-operative complications among the patients undergoing abdominal surgery. Effectiveness of pre-operative counseling in the reduction of post-operative complications. So, can you identify which is the independent variable here? You can write in the chat box. Which is the independent variable in this problem statement? Yes. Yeah, pre-operative counseling. Very good. And yeah, somebody has written post-operative complications. So now here only the confusion comes. See, post-operative complication is a dependent variable, which will happen after the intervention. So what is the interventional variable or the independent variable? It is the pre-operative counseling. So post-operative complications in response to the pre-operative counseling we are measuring. So what becomes the independent variable? Independent variable is the pre-operative counseling. Is it clear? Somebody has typed post-operative complication as the independent variable. No, independent variable is the manipulated variable, intervention variable. Post-operative complication we cannot create, we cannot induce among patients. So this is the result of the pre-operative counseling or the post-operative care, how it is being provided. So the complications are always the dependent variable. So here the independent variable is the pre-operative counseling and the dependent variable is the post-operative complications. Is it clear? Now, here, can you match the following? We have given some categorical variable and different types of variables are given on the right side. So can you try to match it? Which is a categorical variable here? You can write down which is a categorical variable, which is the continuous variable, which is a discrete variable, abstract variable, and dependent variable. One is C. Yes, correct. I'll wait for some time. So all of you can give your response in the chat box. Which is a continuous variable. Yeah, now everybody is answering for the first one. So categorical variable is the gender. Yes, correct answer. Because they can fall into either male or female category. So correct answer. Now let us move on to the second one. Which one is a continuous variable? Which one is a continuous variable here? Yes, continuous variable. People are saying that temperature. Temperature is the continuous variable, correct? Because temperature you can say that in 98.2 degree Fahrenheit, or you can say in decimals. So temperature is the continuous variable, correct? Excellent. Then the third one is the discrete variable. Which one is a discrete variable here? Which one is a discrete variable? Yes, discrete variable is number of children, because you can say, sorry, you can say only one child, two children. No, so discrete variable is the number of children, correct? Okay. Now let us see which one is the abstract variable. Which one you will call it as an abstract variable? Yes. Yes. We are getting correct answers. Yes. Yes, yes, yes. So many are responding that the abstract variable is the family burden. Okay. And some have given the maternal bonding also. Yeah. Actually, family burden is here the abstract variable. Of course, maternal bonding is also abstract, but it is also given for example for other variable. Now you see here, which one is a dependent variable, independent variable here? Which one is an independent variable? KMC, yes. The kangaroo mother care is the independent variable, isn't it? Because it is an intervention which has been done by the researcher. So then kangaroo mother care is the independent variable. Then which one is the dependent variable? What is the benefit of kangaroo mother care? Yes, maternal bonding. So maternal bonding, though it is an abstract variable, it is also a dependent variable. So now what do you understand from here? A same variable may share multiple characteristics. For example, it need not be an exclusive continuous variable, and it need not be an exclusive independent variable. An independent variable can be a continuous variable. It can be a categorical variable. It can be an abstract variable also. Similarly, dependent variable. So they will be sharing the characteristics of the other. So this is how the variables are being are described. Okay. So you now I think you have understood. Here also we have given the number of pregnancy also can be the categorical variable. Okay. So now I think this exercise was helpful for you all to find out what are all the types of variable. Now let us see, we also use the term research title, research problem, research question we use, and we use research title also. At the end of the study, the research title is used. What is this research title? It is just mentioning the, in a simple, clear form. For example, effectiveness of using condom on STD control. So here you are not having the study design, you are not having the setting, population, why it was done, nothing is given. Only effectiveness of using condom on STD control. So using condom is the independent variable and STD control is the dependent variable. So like this, you can mention only the variables and the relationship between the variables, then that becomes the research title. Now the exercises continues. Here you are seeing some research statements and you can identify the components of a research statement. So in this, can you identify the components of this research statement? We saw the 5 components, you remember? A type of study, purpose, variables, setting, population. So can you identify here, what is the type of study here? Yes, so the comparative study is the type of study. So, and what is the purpose here? Purpose is to assess the study. So that is the purpose or objective of the study. And what are they evaluating? Here, the study variables. The study variables are prevalence and severity of the menopausal symptoms are the study variables. See, here we are not calling them as independent variable or dependent variable. Why we are not calling them as independent and dependent variable? Because they are already present in the women. These are attribute variables. So we call them simply a study variable. And population is the menopausal women, and selected districts of Tamil Nadu is the setting. So this satisfies a research statement which includes all the components of writing an ideal research statement. Now this is next statement. Here also you can see what is the research, the study is there, the purpose is there, the independent variable is there, dependent variable is there, population and setting is there. So can you identify here what is the independent variable in this study? What is the independent variable or the intervention variable in the study? Yes, somebody has written VRT. So the virtual reality therapy is the independent variable. So this virtual reality therapy, it is the effect of the virtual reality therapy is measured in what terms? Which one is the dependent variable here? Can you identify the dependent variable here? Yes, hypertension is the dependent variable. So when you implement virtual reality therapy, whether the level of hypertension is the same or it reduces or increases, it will be measured. So this is how the variables are mentioned. So this is the research design, and objective is studying the effectiveness. Independent variable is the virtual reality therapy. Dependent variable is the hypertension. Population is the women, and area is Delhi. So here you see there is another type of study. Those are, you have seen a descriptive study and an experimental study. Here you are seeing a research design, which is a case control study. This is called as analytical design. Cases are the persons who are suffering from a particular disease. Control or free from disease or suffering from some other disease. They also can be taken for as control. So the case control study is to analyze the maternal risk factors of hyperbilirubinemia among the newborns at selected institutes. So here, how do you classify the variables here? How do you classify the variables? Is it called as the independent variable and dependent variable? What type of variables these variables are? What type of variables? How will you classify these variables? Yeah, they are simply study variables. You can neither call them as the cause variable or effect variable. But maternal risk factors, this is an explorative study. So here, the hyperbilirubinemia, why the hyperbilirubinemia is happening? You're doing a kind of an associate, finding out an association, So these are all indirectly the cause and effect variable. But you cannot call it as a purely independent and dependent variable. These are these are attribute variables which are already present in the mother. You are trying to find out the relationship. Yes. So you can call maternal risk factors as independent variable and hyperbilirubinemia as dependent variable. But though it is called as an independent variable, Here we are not doing any kind of intervention. We are just doing only an exploration and finding out the relationship. So these are all not truly independent variables. Maybe you can call it as a cost variable and effect variable. Yes. Now, as we said, the research problem can be written as a statement and it can be written as a question also. So this is the example how you can mention the research problem in the question form. Will WHO Labor Care Guide have a positive effect on objectively measured health outcomes as well as patient reported measures? So here you see that they are not mentioning a direction of the relationship between the variables. So simply they say that whether the labor care guide will have positive effect on the health outcomes and the patient reported measures. So this is how you can write it in the questionable form also. So here, can you find out the variables? What type of variables you are seeing? So here you also have to take it as an example. In a single study, you can have multiple variables. It is not necessary that you have to have only a single independent variable and single dependent variable. You can have multiple independent variables and you can have multiple dependent variables also. For example, smoking, effect of smoking upon the patient's health condition. Smoking can lead to hypertension, smoking can lead to cancer, smoking can lead to the other problems. So like that, you can have multiple dependent variables, and it can lead to coronary artery disease. Like that, you can have multiple dependent variables. Similarly, you can have multiple independent variables also. Smoking, lack of exercise, lack of balanced diet, leading to renal failure, coronary artery disease, multiple other dependent variables can be there. So here I am getting the answers. So here, what is the independent variable? Independent variable is the WHO Labor Care Guide. When it is used for monitoring, then what are all the dependent variables? There are two dependent variables here. One is objectively measured health outcomes, and the other one is the patient reported measures. One is you are measuring whether there is prolonged labor or the stages of labor was normally progressing. That you are assessing. Whereas the patient will be saying, because of the WHO Labor Care Guide has included respectful maternity care components. Because of that, their satisfaction level may be higher. So that is patient reported measures. So a single intervention and multiple dependent variables are there. So this is a typical example that there is no restriction that you need to have this many dependent variables and this many independent variables. Yes. So with this, the session is completed on research problem. We saw what is a research problem, the definition of a research problem, what are all the sources of research problem, and how to select, narrow down, evaluate, and communicate the research problem. And we also saw how to write down the research problem statement, the characteristics, and what are all the different types of variable. And we had exercises on various problem statements, and the participants were able to identify the different types of variables. Thank you very much. Now I can answer the queries. Thank you.
Thank you so much, ma'am, for
Yes.
such an elaborative and interesting and interactive session on research problem and other topics, in which you have discussed in in an interesting way about what is research problem versus what is a research question, as well as what is a research title. And you have given a lot of examples in it. And then you have discussed about sources of research problem, how we can develop and refine research problems, different types of variables, and then learning activity on how we can identify the different variables, operational definitions. So Ma'am, only few questions have been put up. I think the participants were fully involved in the session, and there are just two questions. Like, first question is how to choose a problem statement for PhD level.
Yes, please. So now the questions can be read out.
Yes, ma'am. The first question is how to choose a problem statement for PhD level.
Yeah, for PhD level, usually we expect a study which will contribute significantly to the knowledge base of the profession. So usually we expect a problem of higher magnitude, and it will bring in better outcomes. And then the size of the samples will be expected to be on a higher side, and very rare problems can be taken. We have to do a gap analysis, what is already known about the topic, what is not known about the topic, and what can be known about the topic. So usually at PhD level, if we are able to create a new knowledge, or the outcome of the study adds to the knowledge and practice base of the profession, that will be appropriate. Yes.
Ma'am, another question is that why in nursing there is lack of true experimental researchers?
Yeah, I think a true experimental research design, it is also happening in nursing. Many research studies are happening as true experimental design. I will not say it is not happening. But true experimental designs, whether it is done by nurses or doctors, doing on human beings will have certain limitations. One is getting the homogeneous population, and then the cooperation of the patient, and ethics. We have to follow the principles of natural justice. So all these will be taken into account. So sometime, no, because of not having equivalent control group, and limitations of randomizing the population, all those makes us to have lesser number of true experimental designs. Yes.
Thank you, ma'am. Ma'am, another candidate has put up a question that when we state the problem statement for systematic reviews, what is the criteria to be kept in mind?
I think when it comes to research designs, we can answer, no? What, can you repeat the question?
Ma'am, when we state the problem for systematic reviews, what criteria is to be kept in mind?
Systematic review, no, there is a methodology which has to be followed. Like you have to define the problem, and you have to look at the evidences which is applicable to your population. And again, you have to do the feasibility analysis of the studies. There is a Prisma flow chart which is available, and there are certain steps which has to be followed when you want to do a systematic review. We are having a separate session on research designs. I think there these questions will be addressed.
Thank you, ma'am. Ma'am, other questions are there, but these are not related directly to the topic.
Yeah. Yes.
Like
PICO format is also used, no? Problem identification, yes, and then comparison and measuring the outcomes. So the formats will be discussed in detail during the research design session. Yes.
Yes, ma'am. Research design sessions will be taken on 11th and 12th January.
Yes.
So in that, this can be maybe taken in
and
more
somebody
details.
is asking, is STP studies are of no significance, ma'am? See, if it is a newer area, then it is okay. Like during COVID time, we were educating, it is a newer disease, then it is appropriate and significant. Whereas if it is done only for the purpose of doing the research, then it is not significant. If it is really benefiting the population, and you have to have some of the practice components, they must be able to carry upon the educated content, and some behavioral changes take place, then it will become a significant study. And somebody has asked, what is a Gantt chart? Gantt chart is nothing but the timeline, how are you going to progress with the study? How much time you will take for formulating and identification of the research problem, and how much time you require for review of literature, for data collection, and when you will be able to complete the chart. So that you will be putting it with the timelines. That is known as Gantt chart. And how to write a concept note? Somebody is asking. Concept notes are usually invited by the funding organizations. They just require one-page concept note to see whether the problem is significant and whether they can consider for funding. Initial stage, they ask for a concept note. That is broadly for selecting the study, for the accepting the study. So they mention usually the problem area and the background studies, whether the researcher is having prior experience, and what are all the objectives and the framework and how much budget is expected. This will be there in the concept note. It is a simple form of a research proposal. And once the concept has been accepted, a detailed proposal will be submitted by the researcher. Yeah.
Ma'am, another question is, when writing a research problem, I was told to write in such a way that answer is not always yes or no. Instead of, will there be questions? What are the differences like that? Is
That's what
it
you
not
can
true?
give. Yes, very good. They can that's what I have addressed in my session also. It can be a statement or it can be a question. So when you put it in a question, you are very neutral. You don't know, will there be any effect of virtual reality therapy upon hypertension of selected population? So you do not know virtual reality therapy is going to cause any difference in the hypertension. It may remain the same. So that is a neutral approach. So you can have it in the question form or you can have it in the statement form. In the statement form, if you want to mention, then you will say a study to assess the effectiveness of virtual reality therapy upon hypertension in the selected population. So that is the difference between a research statement and research question. Research question will be usually in the interrogative terms.
Thank you, ma'am. Another question is, any recommendations for good databases or virtual clinical studies as a source of research problem?
Yeah, databases, you can see PubMed is a database, Sinahal is a database, and you can see the Web of Science. These are all the databases which has got good articles, peer-reviewed articles being published. That can be taken. And you are also having next session is on hypothesis, and after that we have an exclusive session on review of literature. In that you will understand how to perform a review of literature. Even how to conduct a systematic review will be addressed in the session on literature review. And yeah, so
Ma'am, there are no more questions.
What is the difference between active variable and
Active
independent
variable and
variable?
independent variable.
As we said, no, active variable and independent variable are same only. Independent variable is the intervention variable. Active variable also, the researcher has to actively modify the variable. So both are same only. Active variable and independent variable, cost variable, these are all the multiple terminologies which are used.
I think, ma'am, these were the only questions related to today's
Sample
session.
size for qualitative study will be addressed later.
Yes.
Until you reach the saturation, you have to have the sample size. And somebody has asked, when the statement is stated clearly, is there is necessary of stating aim of the study? A statement of the problem mentions only the variables and their relationship. Whereas in the objectives of the study, you will be further splitting it. Are you going to simply assess? Are you going to compare? Are you going to see the relationship between which variables you are seeing? If there are multiple variables are there, you have to write down multiple objectives. And the hypothesis will be and a hypothesis will be created and hypothesis will be analyzed based on the objectives. So statement of the problem is also required. Objectives of the study is also mandatory.
Ma'am,
Effect
one
of
candidate.
education during pre, intra, post delivery of labor outcome. Which study design? So this is a longitudinal study design, or you can take it as a primary nursing care model. Like the same nurses, they follow up the patients from antenatal to that of postnatal one. It can be a nursing care delivery model which has been evaluated. What
Is
is the
it
sample size
necessary?
for PhD? Again, you have to do the sample size calculation. Yeah.
Ma'am, is it necessary to write research statement and research question in a study?
No, you can write any one. It is not necessary that you have to mention both. But some people expect statements, some people expect research questions, so the students are writing both. But it is not required. You can write only the statement or the research question.
Ma'am, one candidate has asked, while writing research statement, does first letter of every word have to be in capital?
Yeah, that you can see the APA style and Vancouver style, how they are mentioning. Usually it is written that way. Even when you're, not only for the research article, even when you're writing textbook and other essays, usually the first letter of the side headings are written in capital letters.
Thank you, ma'am. I think all the questions are answered.
Yes.
Thank you so much for this interesting and interactive session. And at the end, I would like to thank all the delegates also for patient listening and for their active participation in today's session. Tomorrow's session will start at sharp 4 p.m., which will be on formulating the research objectives, hypotheses, and assumptions, and will be taken by Dr. Suresh K. Sharma. So kindly join at sharp 4 p.m. Thank you so much.
And it is also encouraging to note down, we have international participants attending the session. We have someone attending from Shiny Edward from USA, and we have a group of faculty members attending from Oman, from Sultan Qaboos University. So this is very encouraging, and we hope that we met their expectations. Though this course was designed for postgraduate and undergraduate students, having the faculty from other countries is highly encouraging for us to host such programs in future.
Thank you, ma'am. Thank you, everybody.
Yeah. Any other responses? Yeah. Okay. Thank you very much. We have 8 more minutes. If there are any more questions, we can attend. And we regret the technical glitches which has happened in the beginning. So we wasted few minutes in the beginning. What is the importance of keywords? Yeah, keywords are part of the abstract. It is necessary to mention the keywords because keywords will be helpful in searching. Because we may use certain words or the variables or the concepts which are used in the study. So when somebody is searching on Google, the keywords will be helpful for them to reach out to our article. That is why it is necessary to mention the keywords as part of the abstract. Yes. Is there a pre-test and post-test? We have not designed a pre-test and post-test. Pre-test was anyway not done. The post-test may be thought of maybe at the end of all the sessions we can have. And one more question. Some say that use of the word effectiveness is bias on the part of the researcher. No, you can say effectiveness. You're not mentioning what type of effectiveness. It is a neutral one. You're going to see the effect. Effect may be positive, effect may be negative. So impact is the word is also used. So it is all neutral words. It can be used. Effectiveness word is not the bias. Yes. Somebody has asked, can I have one example at PhD level? In problem statement, there is no difference whether it is done for MSc or PhD, So it is depending upon the area of research, the topic selected. So there is no guidelines how you have to write a statement of the problem for PhD study. Somebody has asked, give one more example of abstract variable other than family burden. For example, anxiety. Exam anxiety of the students. You want to measure the anxiety of the students before the public exam. Then it is not visible. Only if a person says how much they are anxious, then you will be able to measure it. Pain is also an abstract variable. Pain can be measured on a visual analog scale or a numerical scale or phase scale. So pain is a typical example of abstract variable. Coping, stress and coping. Stress is an abstract variable. How they are coping with the stress is also an abstract variable.
They have asked, why is knowledge, attitude, and practice studies not encouraged?
It is not that it is not encouraged. It is anyway, ultimately all the studies will be improving the knowledge and practice. But then, the practice must continue. It has to modify the way we practice. That is what the outcome is given more importance.
Ma'am, someone has asked, in abstract, do we have to show the definitive results?
No, not necessary. In the abstract, you have to give the results, but I don't know what do they mean by definitive results. You have to give the percentages, frequency percentage and what is the level of significance you can mention in the abstract. And sometimes people think that the only predicted results, if it is not there, they get disappointed. For example, when this maternal risk factors and hyperbilirubinemia was done, the candidate was upset that she didn't find any relationship between oxytocin administration and hyperbilirubinemia in newborn. Then I said it is a significant result because we were thinking that if oxytocin is given antenatally during intranatally, the baby will be experiencing hyperbilirubinemia. It was not so. It was premature rupture of membranes which was causing hyperbilirubinemia in the newborn. In the sense, of course, oxytocin also some newborns have developed, but a significant percentage of newborns where their mothers had premature rupture of membranes, they had hyperbilirubinemia. So sometimes, no, the results may not be in the way how you want it to be. Even if you are observing a different result, it is a significant finding. It should be communicated. How many words should be in problems? There is no limitation. It should be clear, simple, and clearly stating the variables and the relationship between the variables.
One candidate has asked, can we replicate the nursing research at PhD level?
Yes. Whatever study you are taking at MSc level, you can expand the study with more sample size in a more setting. You can increase the number of variables. You can make it as a longitudinal study. Definitely based on your MSc study, you can do your PhD study. Yes. So how can we control the extraneous variables in the study? One way you can control the extraneous variables is a procedure called cohorting. Cohorting means a group of people during the period of study, they will be present in a controlled setting. That is one way of controlling the extraneous variable, which is very difficult in the studies on human beings. If you are doing animal studies, they are kept in the same lab, under the same temperature. The food is given in the same time, in the same quantity, and one group will be given the drug, one will not be given the drug, a placebo will be given. That will be the only difference between the control and experimental group. So that is possible in animal studies, but in human studies, it is very difficult. But to the maximum, we can have them in a controlled setting. Can we write the setting name exactly or as selected one? You can write exactly also, like they write in the state of Tamil Nadu, in the state of Uttar Pradesh, like that. Like that you can mention, and or you can say the selected districts or in the selected areas. Both the ways it is acceptable to mention. Can randomization can help control reduce extraneous variables? Randomization can help to certain extent. That will ensure the every participant has got an equal chance to get into a control or experimental group. But extraneous variables may not be really controlled through randomization. Yes. So it is 6 o'clock. So thank you all very much for staying continuously for 2 hours with us, bearing with the technical glitches during the initial period of the session and making the session more interesting with your questions. Thank you very much. And thank you, Rupinder, for being the moderator of the entire session. Thank you.
Thank you, ma'am. Thank you, everybody. And kindly join tomorrow at sharp 4 p.m. for the next session. Thank you.